special guest, Axel Hellwinkel. Axel, thank you so much for joining us tonight.
Thank you for having me.
It's so good. And if you listened to a couple of episodes ago, everybody, Axel's the one Brittany was saying wanted to come on and that we needed to talk to him. So we got him. So thank you for being available for us, Axel.
Thank you to Brittany for recommending me. I'm happy to be here. Thank you very much.
Awesome. Well, let's get started. How did you come to learn of Lipoedema and when was that?
Oh my God. This was 25 years ago. I'm from Germany, and as a massage physio, occupational therapist, speech pathologist, the manual lymphatic drainage education is an additional you need to have. So everyone is trained in manual lymphatic drainage. And I went to a place, an academy, which was also a rehab hospital. So they presented patients to us, so lymphedema and lipoedema patients. And this was actually 24 years ago.
Wow. So during
That's so
your training...
good that you must train in lymphatics. I wonder, is that a recommendation for Australia as well, or just in Germany?
I don't know what the recommendation is. It's that it's easier to find a job if you have the additional education, and we do manual lymphatic drainage after every surgery. It's a stimulation of your immune system, except for kidney and heart surgery, where we don't want to move too much fluid. But it's an amazing way to support the patient in the recovery, in the healing. And we have more than 60,000 therapists in Germany.
Wow.
Yeah,
they just put some 10 stockings on you and away you go.
Yeah, I know. And I just came back from our Australasian Lymphology conference in Adelaide, and there we have our annual general meeting. And the announcement was that we are 850 now in Australia and New Zealand together. So,
oh wow,
we are growing.
Yay! Yep. And so you were trained in Germany. What is the difference, or do you know the difference between like the education you get there and what is given here? Like, is there correlation or is it very different?
No, it's not very different. The only difference is that we only have manual lymphatic drainage after Dr. Fodder. So when you go to a place, it's a medical treatment, it's not cosmetic. They can't call it manual lymphatic drainage or lymphatic drainage. If you go to a place in Germany, it's always after Dr. Fodder.
Right, that's the VODA method that we keep hearing about here in Australia, and we have manual lymphatic drainage therapists that aren't trained in the VODA method, but they're trained in other methods here in Australia.
Yeah.
Right, so they're all VODA trained in Germany.
Yes, they all are.
We
work I worked in a hospital setting. So you have surgery the same day or the next day we come to you and you have your first treatment.
And you're saying, sorry, Shell, I'm overtaking, but you're saying that it's for all surgeries. And I'm curious, just because I'm pregnant at the moment, I'm curious, does that also include things like cesarean section?
Yes.
God. What if I had have known about this when I had my first cesarean section? Because nobody talks to you about manual lymphatic drainage. The only way that I heard about manual lymphatic drainage was after I was diagnosed with lipedema.
Yeah, I know. And the problem is we are just so little, just a small group of therapists. And manual lymphatic drainage was developed as cancer aftercare treatment. And so most of my colleagues work in oncology and don't see any other patient. So for everyone coming not out of the oncology area, so out of the cancer area, it's even harder to find a therapist. Because in a cancer center, you only see cancer patients.
And I've heard the wait list is really long for those cancer patients too, to get a therapist to help them.
Yes, and all my colleagues are just trying to help everyone, so they have to then quite often move to pumps because it takes time to measure patients as well. You only have a certain little window for your patient, and you have to cover everything. So quite often they go in and they don't get the manual treatment. They are in a pump or get measured because it's then a session gone again.
Yeah, you can't get to everything you need to do in one session. Yeah, spreading yourself thin, trying to get everything and see as many people as you can.
Yeah, absolutely.
Yeah. So for our audience, can you tell us the difference between like VODA and other MLD methods that are out there?
Yes, it's a tricky question, and it's an interesting point because for me it doesn't make a difference what kind of therapist you see. What you have to see is a therapist who understands your tissue. There are techniques, they are a little bit lighter. We know a firmer grip is sometimes more recommended, especially when we have a protein-rich swelling, so after injuries. It's an interesting question, and yes.
Is it different sequencing, or is it more
no, they're both
hand placement or pressure?
We work on the same pathways, but it's a different grip, it's a different maneuver, but both, there are other techniques as well, they are all slow. So and you have to understand, if you go to a manual lymphatic or lymphatic drainage place or lymphatic massage place, and they work deep tissue on your muscle, you are on the wrong place. We try to reach a connecting tissue, so the level in between skin and muscle, because this is the superficial little lymphatic openings. We want to move fluid into them and stimulate the backflow.
Yeah, you make a good point for those people that are possibly listening here that haven't yet explored manual lymphatic drainage and maybe a bit intimidated by the hands-on treatment. It is very gentle.
It is very gentle.
And it won't hurt. I mean, we have tissue that is inflamed, and we also have tissue that probably hurts to touch sometimes.
Yes.
This sequencing and what you guys do is very gentle and not painful at all.
No, it's not painful. It's gentle. It's if it is painful, the tissue tightens and we block or close the lymphatic vessels. So we want to keep it gentle, but with a certain pressure that we just reach the whole connecting tissue, if this makes sense. Just it's interesting to explain my work. Yeah.
No, so the difference is just the training that they've had. You work on the same systems, the same sequencing, moving it in the same direction. It's just that hands-on technique that you've been taught, the VODA method, that is the difference.
Yes.
Yeah. Okay. Awesome. So what is your professional approach to lipedema? If someone came to you and they have just been diagnosed with lipedema, how do you care for them?
At first, we have to assess the body and the tissue. How far are they in? What's their problems? Do they experience pain? And what is their goal? The most important question is, what is their goal? And for some people, it's pain relief. Some people want just slimmer legs. They don't experience the pain in this way. It's everyone who comes with a reason, and every goal is important. I know sometimes that people leave too early compression because the doctor said it's only needed for this period of time. And the first thing they want to go, it's just out of compression. But when we see that there's a lot of volume removed, the skin can't follow. It's important to stay in compression to help the skin. And it may take a year or 1.5 years. It depends on the volume you take out. And it also depends on your age, or on the elasticity of your skin. But then it's your goal. And even if I would have loved to see you longer in compression, if you want to leave, this is your goal. If your goal is getting smaller legs to have a better gait and be pain-free, and you don't care about your skin, yeah, off you go. It's your goal. And this is what we have to assess. And over the journey, over the process, we have to recheck if this goal is still valid or if you have to change. Because what we see when patients go with for liposuction, where flat-knit compression is needed, pre and post-surgery, we see that they quite often experience, if they have painful connecting tissue, we experience or see that they get a pain relief by just wearing the compression. And they get so hooked up with it. They love it. And they love to stay in it, and they really get the reward in the end and get beautiful legs. So, and I have some examples here where we reduced the legs by half, going from a 100 centimeter circumference and the upper thigh to 53, 54. And even after a year, when they come for remeasurements, you still reduce. It's amazing. And it's always brings joy to me as a therapist to have success stories.
Yeah, I bet.
Absolutely. We want all the success stories. We want to show that we can, that the conservative management that we put in place is vital to, even if you're not doing surgery, that it's going to make a difference, that it's going to support you. And like you said, like, I love wearing my compression now. Like, I didn't wear it the other day, and I was like, why are my legs feeling a bit, like they felt like watery? Yeah. Like there was water in my legs. I was like, this is a weird feeling. It's like my legs were swishing. And then I went, I went for a big walk just in normal tights, not compression. And yeah, my poor legs couldn't handle it.
Yep.
But they're good. They're good again now. Only took a day. It's okay.
It's okay. No, and it's. I think what we have to, as a therapist, what we have to create with our patients is the toolbox. There are events, there are days. They want to leave the compression. They want to look fabulous. Compression can look fabulous, but I get it. And then we have to see there, because we have to guide them. It's not only compression, it's exercising. And sometimes exercising becomes possible with compression because the legs get lighter. And it's also the diet. And I'm not thinking about counting calories. It's what's causing inflammation in your body, because inflammation creates water retention again. So the legs, you blow up, your legs getting heavier. And also what I see when patients start with compression or the liposuction to reduce the lipedema fat, is that other diseases, other stories calm down as well. Because you have the permanent inflammation in your body. And if this is out of control, everything else like endometriosis, IBS, everything else gets triggered by it. And they are able to control their side stories by a little regime of compression, healthy diet, and walking. And again, the diet, some people believe in keto, some people need carbs. You have to work through it. There is no template for everyone. Everyone is different. And this comes back to the treatment as well. Everyone is different. Everyone is unique.
Yeah, we've said it quite a few times that even though like we have this common thread of lipedema, We all present so differently. We all have such very different and vast lives and what got us to this point. So being told like, okay, here's the blueprint, follow that, it doesn't work. Like we are all so different. So different. Like even when it comes to compression, some people don't like class 2, like it's just too tight, but they can wear a class 1. And, you know, we're all so different. So it's good that, I'm glad you said that that just validates what we had already started to figure out, that there is no one size fits all.
No. You may cover a main group of patients with a standard therapy plan, but you don't get everyone. And who doesn't like a challenge? I do as a therapist.
And that part that you mentioned about checking in periodically with your patient, whether the goalpost has moved, I think, you know, that resonates with me now more than ever as I'm moving through pregnancy and have to have limitations on what I can do conservative management wise. So like a pregnancy diet isn't necessarily anti-inflammatory. I mean, it could be, but the cravings are quite strong, and not being able to wear my standard compression because my tummy is growing and it's uncomfortable around the waistband, so I need to find new compression, lighter compression. My MLD can no longer go around my stomach or abdomen area, and they had to stop doing that area as soon as I told them I was pregnant, and then they just worked on my extremities, so I couldn't go into my pump. All of those things have changed my conservative management. So coming to somebody like yourself or like my manual lymphatic therapist, having that hands-on personalised approach where we can tweak things is really valuable to have that support.
Yeah, so true, so true. And again, this is a period. This will finish at some point. Congratulations to your pregnancy. And and then you go back to your normal routine, or just try to go back and not to have too much damage through the pregnancy. You say it's your second one. So what was the impact?
It's going to be so interesting, Axel, that I didn't know about lipedema when I was pregnant the first time. And I certainly didn't know about the lymphatic system and manual lymphatic drainage, and how manual lymphatic drainage can support your wellness just as much as it can support any of your, disease processes like lipedema and all of that, because it's a waste management sort of strategy, I suppose. And so I feel like I'm optimistic in terms of my my labor, after labor, post-labor experience, and my healing journey post-labor, that it could be expedited because I know how to support my lymphatic system. That's just one more avenue of wellness that can help that process that I didn't know before.
Yeah. Because we know lipedema is triggered by hormonal changes, and pregnancy is a hormonal change. So it usually starts at pregnancy. But I have patients, they were always slim till pregnancy or till menopause even. So they just suddenly exploded without changing anything in their lifestyle and their diets. And I couldn't understand it. But needed 2-3 dress sizes up every year. And it was just unbelievable.
Yeah, it's going to be interesting. Watching with determination to try and do everything I can to avoid any of that progression, but really with interest to see whether that actually happens for me now that I've got these strategies in place.
Yeah. Fingers crossed.
Yeah.
Another point I want to mention with the compression is when we have, and this is again a side story, we have to look at the veins with the patient, and in the recommendation how long they have to stay in compression or if they should leave. So every time you have a job where you sit or stand and don't move, we have this pull of the gravity in the tissue. And if you have a history of vein issues in your family, or if you have very big legs and a lot of tissue you carry around, and you can already see spider veins and all varicose veins, then compression is highly recommended.
Mm. Yeah, and you make an interesting point because, especially where I went to get my surgery with Lipoedema Surgical Solution, they check your veins first and they, sort of, it's mandatory to sort of fix any vein issues that you have before you go through the Lipoedema surgery. So, but with vein issues or vascular issues, it's a different kind of compression or a different class of compression. Is that right, usually?
Usually, yes. With the lipedema patients, we have, of course, to see the whole leg and how much tissue we have to carry. If it is a slim leg, if it is a further staged on leg, then we have to go for stronger materials. And then if it is very curvy, I always recommend flat knit, because in the end it's more comfortable than round knit material. So behind me there are round knit models, so they look like stockings, normal stockings. The flat knit material is a little bit thicker, but it supports your tissue way better, and it doesn't cut into you. Once placed properly in the morning, it usually stays. Yes, you have to pull it up sometimes if you move a lot, but it usually stays quite well on your body.
Yeah. And, it just sort of demonstrates that there's options in having someone like yourself in a clinic, hands-on, able to see the patients. You can sort of give them some advice on what might work best for them, whether it's for their vascular issues, whether it's for lipedema or lymphedema, etc. So, Axel, you mentioned supporting women pre and post surgery. I'm really curious about your what you notice post surgery for women who have liposuction to remove the lipedema. I'm curious to know whether the lymphatic function of those patients improves after their surgical recovery, because effectively they're going back to stage 1 or like the earlier stages of lipedema after they've got some of that or the bulk of that tissue removed. Do you find any improvements in their general function of their lymphatics?
Again, it depends on the size of the legs, the volume which is removed. Usually, look, post-op you start with swelling, so the compression garments are there to stop this. Swelling is needed. It's the body's response to an injury. It's sending out proteins we need for healing of the body cells. So, and there's fine damage to the superficial lymphatic vessels in the connecting tissue during this, because of the surgery. And when the healing kicks in, we see a beautiful reduction. Again, to answer your questions, I have to ask you, what's your goal? Because it comes back to the first question. You have to figure out with your patient what's their goal. And then if there is a history of vein issues in the family, or are there physical varicoses or spider veins, then we should consider, and of course, what's your job situation? Are you sitting at a desk? This is not supportive. Yes, usually the legs get better, but it's such a combination of things, because I have patients, they run after their dog. They couldn't do it beforehand, before the surgery. They jump over fences now. They couldn't do it beforehand. So you automatically get a little bit of more activity, because you get lighter legs in return after the healing process. And I had a patient, she went for another reason to a plastic surgeon around the corner. And she went for liposuction, and they figured out she has lipedema in the end. She was a little bit older, but she embraced herself to pull herself up the stairs 1 week post-op for the follow-up. And she couldn't believe how light it suddenly was to climb stairs. Now she is a little bit older, and I try to encourage her to embrace the new legs, because she kind of accepted that she is a couch potato, couldn't do anything, watching TV with a pack of chips. And I tried to encourage her to see her new legs, to embrace them, and to get a second spring, or whatever you want to call it. Just to use your ability and opportunity and get active. What we see with a lipedema patient, and when the fat is removed, is because the inflammation is gone, that they are able to build muscle. It feels like the lipedema fat is restricting everything and suffocating your muscle. And suddenly they can work out and do more things and being more active. So it's quite interesting. And again, it may not fit you. It's again, we have to look at the whole patient and the whole body.
Yeah, that's a good point. I guess what I'm hearing from you is that like a functioning lymphatic system, like between a functioning lymphatic system and an optimally functioning lymphatic system, is probably not what we're trying to measure here. We're just trying to measure like the quality of life as a whole to see how we're going. So it's a little bit too complex to just measure lymphatic function.
Yeah, yes, we can see the lymphatic function. There are imaging possibilities nowadays. But the whole backflow system needs the muscle pump, needs really activation. And my recommendation to everyone who works at a desk, to make up for it, to being so stagnant the whole day, go to the gym afterwards or go for a walk. It doesn't have to be a gym. It just sounds awful always. Go for a walk, go into the pool. And I have patients, they swim a lap and then they walk back and swim and walk, because the deeper you're in the water, the stronger the compression. And to exercise in compression, it's the best support you can give your body.
Nice. I've got another question about compression wear, and this is just my curiosity, coming through, but wearing compression consistently, is there any way that would hinder your body's own mechanisms to support your own lymphatic system and like do it itself? I understand if we need it because of our lipedema, but does there come a point where we just don't need it and it's a hindrance to do it all the time because we don't need it?
Look, you support your lymphatic system with compression, but you can live without it when you move enough, if you don't have a medical reason to wear them. And what we see sometimes when people live too long before and after surgery, you literally have to live in them. When they leave the compression for the first time, I always ask them to sit on the bed or lie down for a moment, sit up, because sometimes the vessels are not used to do the job by themselves and the blood pressure drops. So, and this is when they then faint and fall. So first time after surgery, you leave your compression, make sure someone is around. You don't go alone into the bathroom and have a shower. No, you make sure you sit for a while on your bed and someone is around to help you, because the veins can get a little bit lazy and the blood pressure can drop and then you're on the floor.
Nice. Yeah, good advice. And I remember that feeling post-surgery, having my compression off and just feeling like I'll just stay sitting or lying down. I was too scared. But even, a long time post-surgery, even having those compression-free days after I'd reached that point where, I was cleared to sort of have some compression-free days. It takes a lot to get used to the sensation of not having compression on your legs. It was so strange. And in fact, I definitely prefer to wear compression nowadays. I'm a convert for sure. Looking forward to going back to consistent compression use when I'm, finished having these babies and everything. So yeah, it's a very different feeling not wearing compression anymore. But it's nice to know that the option is there. Like I've got that freedom to wear it when I'm struggling. And like Shell said, when she went for a walk and she noticed that, she got a bit of swelling or her legs didn't feel great, it took her a day back in her compression to sort of reach a level of feeling normal. And that's like the power of having the choice, I suppose.
Yeah. I have a lot of patients, they ease with the compression later on, when they're happy with the results, but they wear them when they're on a plane because cabin pressure can cause swelling. Not everyone has to experience this kind of swelling, but it can happen, and some people balloon, so they should be in compression when they're on a plane. They wear the compression when they have been naughty. Look, you go to a wedding and there's cake and there's champagne, and this sugar and alcohol is one of the main trigger for inflammation in our body. So they want to be part of it, and it's completely fine. And then they put the compression on the next days because you pay the price. It's like, but I think it comes back to the point to create a toolbox with your patient to really understand what's going on in your body and to react when you need it. And then in return, you get the reward of having little freedoms and going without. It's about understanding what's happening in your body and to act.
Yeah, I love that, because a lot of us, we're not in tune with what our bodies want, not in tune with what our bodies need. And the beauty of this is we start to pay attention. We start to notice changes. And even when we eat, like when we exercise, when we don't wear compression, like it really does bring us into ourselves. And I love that. Like I love the knowledge I'm starting to gain of my own body. It took me nearly 50 years, but...
Better late than never, Shell.
Yeah.
But it's also so hard. Some people, when they start with compression, so I always measure compression for comfort. So the compression garments I order for patients are usually not the cheapest, but we add a zipper, so it's faster to get in and out, especially when you have the small waist and wider hips, and instead of the little hooks, and also to have the comfort of a nice snug fit without restriction. When you start compression, you usually start running to the toilet more often, because with every lipedema, there is also a certain percentage of water content, which is then removed. So you will love the zipper in the first 2 days. And to have this always ready for when you need it is just important. I know it's an investment here in Australia. As I said, I'm from Germany. In Germany, you get 2 sets every 6 months covered by your health insurance. You get the surgery covered by your health insurance. You get a gastric sleeve if you need it, if you have issues to lose weight. Now we have Ozempic coming into the game. We don't know exactly why some patients, lipedema patients, are reacting so well. Yes, it takes the inflammation out. I have some amazing stories with it, with my patients here. Some patients don't react to it. So again, it shows us how different everyone is. And it's so often just this trial testing of things. Does it work? No. Okay, leave it out. Let's try something else. This is quite a journey with the patient always.
Yeah, it is. And as I said before, having someone like you that can not only have a hands-on approach in terms of supporting someone's lymphatic system, but also provide them some advice on and be able to order and measure them for compression. Like that's really important too. And we don't have a lot of that in our community. People don't know where to go to get garments. So we rely on our lymphatic specialists to tell us where to go, and hopefully they have access to these people like you that can do both, which is great.
Yep.
So I'm keen to know, Axel, what's exciting coming up for you this year? And we're already in May, so for the rest of this year.
For the rest of this year. So as I mentioned earlier, I just came back from our Australasian conference, Australasian Lymphology conference in Adelaide. And the next stop is next month, where I'm really looking forward to seeing you live, because I heard you at the Lipoedema conference as well, which takes place 21st, 23rd of June in Melbourne. So I'm looking forward to that. And then in July, holidays.
Great. How long are you having off on your holidays?
I just extended by another week. So I'm gone for 4 weeks. I travel to Europe. So whenever you do this long journey, you need minimum of 2.5, 3 weeks. And I just ended another week, because I haven't been last year, and family, friends, it's just, and the good food, and look, it's summer there, and swim in the Mediterranean, no deadly creatures. So.
Heaven. Well, Shell's also going on holiday in July, so I'm really jealous. I'm going to live vicariously through both of you on your holidays.
But I'm swimming with dangerous things.
And we are very excited to meet you in person, Axel, at the Lipoedema Australia conference. We can't wait to get there. And we'll be wearing our compression on the plane for sure, shall I?
Yes.
We'll be ready with our compression. Now, where can the Lipoedema community find you?
I'm based here in Sydney, in Surrey Hills. They find me on the internet, the address axelhellwinkel.com or lymphatic-drainage.com are my websites to get more information. Yep, and also on the Australasian Lymphology website, we have a practitioner listing. So if you live in Queensland, WA, and Victoria, and all the other states, have a look there. Who is around? Check with them, because as I said earlier, some people work only in oncology. Check with them if they see other patients as well, and try to get an appointment there. For the lymphedema patients, so usually secondary after cancer treatments, my colleagues measure as well for compression garments. So this is the best address you can find.
Awesome. That's great advice, that they have a directory of people that can support them with their lymphatic system. But if you'd like to get hold of Axel, now you know where to go, and make sure you book in before he goes on holidays in July. Otherwise, you'll be waiting another month.
Back on the 8th of August.
There you go. Lovely. Oh, Axel, thank you so much for spending time with us tonight. Looking forward to seeing you at the Lipoedema Australia conference.
Thank you for having me. I hope a lot of watchers and listeners are joining us for the conference. The last one was 2 years ago in Sydney, and it was an amazing come together. I think it's important for the patient to see that other people are suffering as well, and also to see that everyone has a different experience with it, different symptoms. This disease is awful and limiting, and can go in so many different ways, and it's not your fault, it's just you have to understand we try to help you to manage it, but it's not a problem, because I know here a lot of patients get told they're just too fat or should go on a diet, and it's not true. This is inflamed fat which doesn't move with the diet. It sticks, it grows, even with the diet.
Thank you, Axel. That's one of the biggest things, learning that it's not your fault, especially for me or anyone who lives in a larger body and always thought the reason I was in a larger body was because I ate too much or didn't exercise enough, which wasn't true. It's not true. So that one really resonates with us. So to have a provider, someone who's looking after us, saying that too, thank you. Thank you for that.
Thank you for having me.
Thank you for joining us, and we will see you in June. Bye, Axel.
Bye.
Bye.
When we started the Lipoedema podcast, we relied on word of mouth and existing connections.
Our following has happened organically, and we are so honoured by your support.
As we learn more about the world of social media and algorithms, we have a request.
When you are listening to our podcast or watching on YouTube, let us know what you think.
Hit follow or subscribe.
Leave us a comment or write a review.
The more engagement we get, the more our message is shared.
And the greater our reach to those women suffering in silence.
Thank you for listening to the Lipoedema podcast. Lipoedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipoedema podcast. Until our next episode, bye for now.